Hey guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now, without wasting any time further, let's get into today's topic. So, today's topic is aortic regurgitation, which is a aortic valve disorder. Okay, so it is defined as the leak of blood from aorta to left ventricle during ventricular diastole. Okay, during ventricular diastole. Coming to the etiologies of aortic regurgitation, first one is rheumatic fever, as we have seen in almost all the valvular heart diseases. Next is chest trauma, which is involving the aorta region. Then infective endocarditis, syphilis, aortic dilatation in case of Marfan syndrome, and aortic aneurysm. Now coming to the pathophysiology of aortic regurgitation. In chronic AR, the left ventricle enlarges, producing a greater total stroke volume, which is ejected into the aorta, and with progression, left ventricle dilates and finally left ventricular failure develops. Because there is left ventricular failure, there is increase in the left end diastolic volume. So this means the ventricular emptying is impaired, okay, because there is increased left end diastolic volume, so it means there is impaired ventricular emptying, and as a result the cardiac output falls. Then coming to the clinical features, first is symptoms and then we have the signs. So symptoms, mostly some of the patients remain asymptomatic for years, and if symptomatic, the patient will develop palpitations, angina, orthopnea, paroxysmal nocturnal dyspnea, then syncope. Okay, then coming to the signs, so signs include collapsing pulse, which is also known as water hammer pulse, then Corrigan's pulse, Corrigan's neck sign, Hill's sign, Demerset sign, Muller's sign, Landolfi's sign, lighthouse sign. Okay, so I have discussed all these signs in detail in a separate dedicated video which is made on peripheral signs of aortic regurgitation. You can watch that video by clicking on the I button. And since we are discussing it from an exam point of view, so here we will limit our discussion only to the names of the signs, and if you want to see the details, just click on the video on the I button. Coming to the inspection and palpation findings in aortic regurgitation, we get a hyperdynamic apex which is shifted down. On auscultation, we get third heart sound in patients with left ventricular failure, and the characteristic murmur of aortic regurgitation, which is an early diastolic murmur. It is a high pitched murmur, early diastolic, and it is a decrescendo murmur that is decreasing in intensity, and it is best heard at neo-aortic area, that is left third intercostal space near to the sternum. Then we also get ejection systolic murmur due to increased flow across the aortic valve. Then we also get mid-diastolic murmur, which is also known as Austin-Flint murmur, a named murmur, which is heard in case of severe aortic regurgitation. Coming to the investigations. First, we have to do VDRL to rule out syphilitic etiology, because I have already mentioned that syphilis is one of the cause for aortic regurgitation. Then we look for rheumatoid factor and anti-nuclear antibodies to rule out rheumatoid arthritis and systemic lupus erythematosus, basically to rule out the connective tissue disorders. Then on ECG, we can see diastolic overload pattern of left ventricle because of aortic regurgitation, and echocardiography is the diagnostic test. Coming to the treatment, first we have to do the treatment of the underlying cause, and medical treatment of cardiac failure is digoxin, diuretics, and salt restriction. In case of asymptomatic patients, we have to monitor them, and surgical therapy involves aortic valve replacement. So that was about aortic regurgitation. I hope you liked the video. If you like my content, please do like, share, subscribe, and comment, and also press the bell icon so as to get notified whenever I upload a new video. And you can also check on to the other valvular heart diseases on the playlist which is shown on the right side. Thank you.